Hello, everyone. Good afternoon. It's 12 o'clock Central European Time. I'm sorry for the short delay. I'm just getting some checks completed, and hopefully we should be able to fire away very soon. Thank you so much for participating, for dedicating 1 hour of your precious Saturday morning. And I hope I should be able to share some useful information for all of you. At the end of this session, we should be able to answer questions. My team and I were here to answer any queries or questions about any levels and any areas of your fertility journeys that you would like to share with us. Thank you, Maria, my web admin, for arranging this. I can see there's a lot of you on the attendees list. So I won't take very much of your time. I will start very soon. Right, I can see people from England, Wales, Canada, Greece, London. Hi, London, Wales again, very popular. Germany, hi, Dimitris, Athens, New York, Australia, and Singapore. Hi, Joe. It's absolutely fabulous. Hi, Jackie from Coventry. Okay, I'm all very excited. I mean, one of the good things about COVID is the fact that we can all meet regularly, and it's not just patients, it's not just parents. Hi, Tom. It's also amazing partners, associates, and friends, and healthcare professionals from all over the world. So I'm really excited. I will stop waffling now. Just get going. I'm getting going. So I will try to share some IVF news. So it's going to be like a mix of information today. So some of them might apply to each one of you. But by all means, at the end of this session, feel free to fire away and ask questions. And at the end of the seminar, at the end of the webinar, I will introduce some amazing friends, associates, some amazing resources, some amazing people, mainly in England, Wales, and Ireland, so that patients may benefit from the services. I mean, one of the amazing experiences I have felt over the last 30 years of dealing with fertility patients from all over the world is that I met amazing people, and I also made wonderful friends all over the world. I learned a lot of things. I learned a lot of scientific, but also social and holistic things that could be applied to my patients. And through this interaction, hopefully, all the patients can be benefited, and also all of us can become better for providing our services. There's no substitute to collaboration of healthcare professionals, and there's no substitute of aiming and focusing on the number one, which is our patients. So anything we can do to provide our patients with information, resources, services, locally, if possible, in a globalized world, that would make our life and our mission worthwhile. So let me just move on a little bit. Okay, what are the treatment options, and what do we offer here in Embryoclinic? We offer all stages of IVF and ICSI. We offer fertility surgery, which is one of my passions, especially with the advent of robotic technology. We have been able to perform minimal access surgery in very complex situations that affect a lot of our fertility patients. In my time, when I was trained in the 90s in England, we were specialists in fertility medicine and surgery. Unfortunately, in the last 10 or 15 years, fertility specialists are only being trained in fertility medicine, which is IVF, endocrinology, and so forth. And fertility surgery and minimal access surgery has come in the hands of specialized gynecologists in surgery alone. We are probably amongst the last of the Mohegans, but thankfully there's a few like us all over the world, so we can share our experiences and we can improve our skills in a holistic manner so that we can provide our patients all the options. Don't forget, please, that perhaps a good proportion of you, of our fertility patients, they don't have a medical or endocrinology problem. They may have an anatomical or a surgical problem that can be sorted out, can be solved with fertility surgery, and especially with endoscopic techniques like hysteroscopy, laparoscopy, and robotic surgery. Fertility counseling, very important. Later on, I will introduce you to some amazing resources available online or on site in various parts of England, Wales, and Ireland, where you can address your fertility counseling concerns and be sure to be treated as individuals and get top-level service. Pre-IVF testing is very important, in my opinion. Performing IVF is like performing on stage if you're a musician or a performer, or performing on the court if you're a tennis player or a football player. But no one is just living for performance. For one single performance, there's endless hours of training and pre-performance drills. And this is the value and importance of pre-IVF testing. I cannot overstress the importance of pre-IVF testing. My clinic and I were under a lot of pressure to perform treatment tomorrow. We have requests from patients all over the world wishing to start with the next cycle because they're stressed, because it fits with their holidays, it fits with their time off work, it fits with their travel plans. And many times we're under pressure to cut corners and just move on straight into the IVF without any pre-IVF testing. I think we should all resist this temptation, and we should focus on pre-IVF testing, which is the only way we have to optimize our services and optimize not only the success chances, but also the safety chances. At Embryoclinic, we offer all types of donation, egg, sperm, and embryo donation, and of course the surrogacy program. My team and I, we have been following the updates on the surrogacy program all over the world. We have proudly been part of amazing organizations from all over the world. We have acquired quite a lot of experience, but also a lot of knowledge on logistics, legals, medical issues, ethical and social issues, if you like. We are able to advise our patients. We run as a limited number surrogacy program because this is extremely challenging for a clinic to offer it at a large scale. Most of the surrogacy programs all over the world are at the moment under enormous pressure, especially after the Ukraine situation. And we're trying to collaborate with our colleagues and healthcare professionals all over the world in order to accommodate in the best possible way the amazing requests we have from everywhere. I'm available to discuss the options. I mean, we always like to give the patients the options to find a solution locally. I'm very pleased to understand that at the moment there's a lot of law changes in the UK and also in Ireland. So a lot of couples, a lot of single women, and a lot of even men, single men, should be able to have options to become parents very shortly in the future. And I'm very grateful to my colleagues again all over the world who share their experience, their updates, their knowledge, and their resources in order to inform our patients. So I'm very, very happy to share with you some news about surrogacy services later on in this presentation. So I have a short video here. I hope it plays. Yeah, this is our Embryoclinic logo. It's from sales to smiles. That's what we're proud of. And of course, it smiles and cuddles and lots of babies. Recently, my team, they visited some amazing families in England, and we had some gorgeous feedback, and we're very grateful for that. So very quickly, this is for the patients in the beginning of their journey. What does IVF ICSI procedures involve? So pre-IVF testing, as mentioned before, ovarian stimulation, oocyte retrieval, fertilization, embryo culture, embryo transfer, plus or minus freezing. So these are the stages of IVF. Now, these are some of our results for IVF and ICSI, classified in in two subcategories. I mean, normally there's more categories than those, but just to give you a general idea that age is important. Less than 36 years old, the success rate is between 57 and 74%, depending on whether it's fresh or frozen cycles. And the success rates fall dramatically after the age of 37. And here you can see the reflection of the success on the fresh and frozen cycles. I mean, of course, it's striking that frozen cycles seem to have a better success, and this seems to be the trend all over the world for various reasons. And part of those reasons lie on the fact that we have perfected almost our freezing strategies and techniques. Now, fertility surgery, this is, as I said, one of my passions, and in particular, robotic surgery, which has been developed over the last 20 years. However, that certainly in Greece and even in England, it's become more popular in the last maybe 3 to 4 years. In other countries like Germany, it's been around for much longer, and of course in the US, but the options are there. There's a lot that we can do in order to restore normal anatomy, and I'm very privileged to personally have met some amazing doctors and surgeons at top world level all over the world, and in particular in Europe, where our patients can benefit from fertility surgery. Endometriosis and myomas, which are the commonest limiting factors of IVF success and fertility, can be safely and effectively managed through fertility surgery. And as I said, many of those patients, in particular the younger patients, can benefit to such an extent that many times IVF may not be necessary. So fertility does not equal IVF. I mean, this is one of the messages I would like to convey. Fertility and infertility may be managed very, very nicely surgically through the modern minimal access, minimal invasive techniques that can restore the fertility, and then the couples, the women, they can achieve their pregnancies at home and not in an IVF clinic. And this is one of our primary endpoints and focuses. So improved outcomes, and of course, alleviation of clinical symptoms when it comes to situations like endometriosis and myomas. And we proudly present that my team and I have been around, and we've had this experience for over 30 years with a performance of more than 10,000 procedures. This is a short video on robotic surgery. Again, I feel very privileged that I have lived to this day where this amazing piece of equipment, this amazing piece of technology can be provided to our patients. There are wonderful providers all over the world, and I would be more than happy to suggest a local doctor, a local surgeon to look after you using the most modern medical technology. And of course, you're always welcome if you wish us to perform your surgery, and if we feel that this is within our expertise, to take the pride and honor of leading your surgical care. Bottom line is that technology and science are the main factors through which we can talk about more than 90% success rate of our fertility interventions, provided our patients are prepared to undergo all the suggested methods available at the moment. Pre-IVF testing for women. On this side, you can see the standard testing, which includes the hormones. I presume most of you have done those. Later on, I will discuss about the resources through the amazing Andrea Trigo and her Fertility Enhanced program, which is a pioneering digital home diagnosis and home testing that can be provided within the UK and hopefully very soon in Europe and all over the world. So for those who haven't done those tests, there is a possibility of having them done in the comfort of your own home. So this is standard testing, hormonal, infection diseases, and vaginal swabs, and of course scans. There are some amazing facilities I will mention in detail in Ireland, in Dublin, And we have in Ireland, we have Dr. McCaffrey with amazing clinics, able to provide all this assessment in one-stop clinics. In Manchester, in the Greater Manchester areas, we have ScanAssure and Roy Craven and his amazing team, who are leading team in providing ultrasound care at top level at very affordable prices. And of course, similarly in London, ScanAssure are now expanding in London, and in Cardiff and Wales, we have Professor Amso providing amazing services. I will talk about it later on. Now, these are a little bit more advanced pre-IVF tests, usually either reserved for patients with previous failures or with patients with clinical indications. So we like to directly assess your anatomy, female anatomy, before proceeding. We like to perform patency tests, firstly in order to assess the fertility potential, but also to exclude conditions like hydrosalpinx, which may adversely affect the fertility outcomes. The newest technology is the microbiome testing of the uterus, which may provide us with some useful insight into managing and caring for a particular subgroup of our patients. And of course, let us not forget the genetic testing, which includes thrombophilia, karyotype, and so forth. Now, let's not forget men. Let's not forget that probably about 50%, in about 50% of our couples, 1 in 2 couples, there is a potential element of male infertility. We tend to ignore that. So these are the standard tests that we can perform on men: viral and infection screening, semen analysis, and culture. And these are the little bit more elaborate tests, which include DNA fragmentation, sperm separation with the zymote technique, and genetic testing. The value of pre-IVF testing cannot be stressed enough. We ensure optimal fertility conditions. We save valuable time. Most of us, including myself, I have been faced with a difficult situation in which, after 1 or 2 failures, I have discovered something that was missed in the pre-IVF testing. And of course, I'm unable to answer the question, doctor, why didn't we find this earlier? So I think at least we need to cover, more than 90% of the potential gross and important factors affecting fertility before embarking on the journey. And of course, it is very important to have individualized fertility solutions for every patient based on their individual characteristics and pre-IVF testing results. A little bit about egg donation. Egg donation is the use of donor oocytes, which are fertilized with the partner's sperm, if there's a partner, and if she has reasonably normal sperm, the creation of embryos, and then the embryo transfer to the patient uterus. Now, egg donation has been popular always, but it's become more popular in the last maybe 10 to 15 years, especially due to the fact that all over the world, in particular the Western world, women tend to be of older reproductive age when they decide to have a child or a second child or a third child. And in the reproductive ages of perhaps more than 45, the chances of own egg IVF or own egg pregnancy and success are extremely low, and hence women resort to the egg donation. There is a lot of disparity in the legal aspects of egg donation availability all over the world, all over Europe. And this is the area in which all of us, doctors, healthcare professionals, practitioners, nurses, advocates, associations, we have to work together in order to provide our patients with the best possible option. There are some amazing programs all over Europe now, all over the world, if you like, and I feel that it's our duty to give our patients the best option. With the advent of oocyte cryopreservation, there's a lot of transportation, there's a lot of transport at all sites, but of course there's always the choice and option of fresh donation as well. So when is egg donation indicated? When there's premature ovarian failure, when there's poor response to stimulation, when there's history of multiple IVF failures, and of course with advanced reproductive age, but also with maternal conditions affecting either the genes or the ovaries of the woman. Now, we have a piece of news here, breaking news. In Greece, the new legislation put in place in the last few months allows women up to the age of 54 to undergo IVF. And of course, that is quite interesting because that is in line with the legislation in many other countries, including the US, of course. However, there is a little bit of bureaucracy involved here. We have to obtain a specific license for every woman over the age of 54 before she embarks on IVF. And of course, we have to ensure that this is done safely. So we have to ensure that she has undergone very thorough pre-IVF tests and exams. So this is a piece of news. There was a lot of efforts from the fertility specialists of Greece in order to convince the government to move on to this legislation. May I add here that the previous legislation was put in place in 2005. So it took a lot of efforts to be able to push towards that. Of course, the COVID situation helped in the way that we had a lot of women very near 50 or just over 50 who paused their treatment. So they had to complete their already started treatment. And that's one of the reasons why the legislation was changed. And I believe, I mean, we already have quite a lot of interest from all over the world for this age group. But what I would like to stress is that we should not be doing it if there's any risk to the safety of the woman. Now, how is egg donation performed? At Embryoclinic at the moment, we have quite a few programs available. The standard program for international patients involves the first visit, which we call the initial appointment, for 1 to 2 days, during which the medical and fertility consultation takes place, the counseling, the male testing, the examinations, the completion of legal procedures and documentation, the coordination, logistics, and of course, we take all the matching characteristics that will be taken into consideration in order to perform the matching. Following this, the single woman or the couple, they fly away, and then we start the screening and the matching of the donor. We usually quote 6 months, but this can be a little bit variable. I would like to share with you that thankfully now our waiting list is significantly shorter than that. We have 3 to 4 month waiting list. You understand that we have been under all of the clinics in Europe and the US. For that reason, we have been under a lot of pressure because of the COVID situation. All the patient requests, they mounted up, and also it's the Ukraine situation in Europe that has increased our waiting lists. But thanks to our amazing donors who come forward, mainly for altruistic reasons in Greece, at the moment we have a shorter than 6 months waiting list. So they undergo full assessments, our donors. Although by law in Greece it's legal for the donor age to be up to the age of 35, in my unit invariably we use up to the age of 30 in order to get the best possible outcomes and quality. And eligible donors are matched for physical characteristics, personality traits, and sometimes for psychosocial traits. And then we create the embryos. Once we've done the retrieval, the fertilization, and we freeze and store the embryos for the couple. And the second visit then to Embryoclinic for the international couples involves, again, we say 2 to 3 days just to have some leeway, but as you understand, we only need you for a couple of hours to do the embryo transfer. But because of some travel mishaps, sometimes we usually suggest 2 to 3 days. Now, this applies to couples or to recipients, to single women. In Greece, it's legal to treat single women as well as heterosexual couples, married or unmarried, with the upper age limit of 54 for the female partner and with no age limit for the male partner. And this is the standard program we use for patients being within 4 to 5 hours flight away. For overseas patients from the US, from South Africa, from Australia, from Canada, the Americas and all that, we have the one visit program, which is longer. It's a 3-week program during which we perform the pre-IVF testing, and then of course we perform all in one visit. And again, this is optional, and we try to fit into our patients' needs in order to accommodate them in the best possible way. So advantages of egg donation: top quality embryos. This is all we need, all we use. Sometimes there's a bit of disappointment. Our patients say, "Oh my God, you use 10 eggs and I only have 2 or 3 embryos." Yes, indeed, but these are the very top embryos. So we only use top quality embryos with the top possible fertilization potential, which is the overall success rate of our egg donation program with one egg donor stimulation is more than 90% once we've exhausted all the embryo transfers of a single donor. So that's pretty high, and that's why it's not the numbers, but it's the quality. There's high chance of implantation, around 70%, more than 7% per embryo transfer. Lower chance of chromosomal anomalies based on oocyte quality because we have young donors. And of course, sometimes this, however, may depend on the male age, but this has been discussed beforehand. And of course, there's no maternal disorders passed down since we're not using own genetic material. And of course, there's no hormonal injections for stimulation injections for the recipient, since the donor is actually receiving all the stimulation. So success factors, what are the important factors? In my opinion, sperm quality, very important to optimize the sperm that we use for egg donation, and this is based on various factors that our top embryologists are making sure of. And of course, we only use top quality egg donors. We only eventually accept 1 in 5 of our potential donors who come forward. And of course, endometrial parameters, and this is the responsibility of the clinical team, ensuring that the uterus is anatomically, functionally, and in terms of microbiology, in terms of adhesions and all that, fully checked, screened, and optimized. So why Greece? Why Greece for egg donation? And in particular, why Thessaloniki? I mean, firstly, this is, I borrowed this slide from my last week's presentations to our Serbian associates and patients. Firstly, because it's fairly well positioned within Europe. So even from Ireland, the flight is no longer than 4 hours. And again, for North Europe is less than 4 hours. We have very flexible IVF legislation. It's not perfect, but it's near perfect. So we can treat single women, we can treat unmarried couples, we can provide all services, including pre-genetic testing. We can provide surrogacy, as far as I'm aware. At the moment, Greece is the only country within the European Union offering surrogacy services with some amazing advantages, including the court order that's issued before the embryo transfer takes place, which is one of the reasons that even lots of patients from Australia and the US and Canada, they come to Greece because they want to ensure that the child is legally theirs before it's even conceived. Now the reputation is getting better and better. Of course, medical tourism and fertility tourism in Greece started later compared to other countries like Spain and the Czech Republic, maybe. However, there is a pretty big presence of scientific presence of Greece and Greek doctors and scientists all over the world, and plus a lot of very, very high quality clinics, IVF clinics all over Greece that have produced families and babies all over the world. So the reputation is at the moment amongst the best in Europe, at least. And of course, there is cultural, religious, and social connection with most of European and overseas countries. And definitely Thessaloniki is a beautiful and safe city. This is my team. As you can see, lots of females. we can be accused of being a bit biased towards females, but I hope we're not going to be. Some wonderful colleagues here. The average age, I'm spoiling the average age in my team, but still because of my old age. But it is very low. At the moment, if I remember well, is under 38. So wonderful people, very highly qualified. Most of them have been with us for more than 10 years. Only senior consultants working in our unit. I mean, it's not legal in Greece to have research fellows or non-specialists working as fertility specialists, and of course, a big team of supporting staff. So we've been around for 30 plus years. We have a strong connection with the Royal College, which is quite important for us in order for us to be in line with all the regulations and all the missions and visions of the college that I belong to as a fellow. Our lab, we have very senior lab scientists, more than 15 years experience, more than 12 years experience, and even here we have more than 4 years experience. We have the dedicated international team of coordinators. So each one of our patients would have a dedicated team of 2 coordinators plus 1 doctor looking after them, to making sure that all of their needs are met. And this is the donation success rate, as I mentioned before, around 70% success per embryo transfer, and the cumulative pregnancy rate per cycle of egg donation is more than 90%. We have dedicated a lot of time, effort, and resources in applying for awards, because we feel that this is very good for the spirits, and we also like to party. So we are recipients of multiple national and international awards. These are Embryoclinic babies all over the world, as you can see, even Africa, Madagascar, South America, Japan, Singapore, and so forth, and of course, Europe. Now, during the last 20 plus years, 30 years, I came across some amazing people. I would like to share these connections with you, and of course, this is something that I would like to expand. So I'm always on the lookout for amazing friends and collaborators. So this webinar is mainly focused on England, Wales, and Ireland. I hope that I should be able to host a similar webinar for Europe, as the network in Europe is building amazingly. In particular, there's an amazing prospect in building some very strong relationships with an amazing team of Germany, a world-class team offering amazing surgical and IVF services. So I will start with the Alpha Zeta concept. This was a concept that our team conceived maybe 5 years ago. And the concept of alphazeta.com, you can go on the website, was to offer to our patients a full holistic service. So we have this amazing nutritionist based in south of England. We have an acupuncturist, Gordana. We have fertility massage specialists, and we have fertility tapping specialists and holistic care, Sarah Holland. So this is the Alpha Zeta concept. You can go on the website to see what we offer. We used to host on-site in amazing locations holistic services, but unfortunately, because of COVID, this has not been the case anymore, and we only offer it online. Now, a little bit more about Sarah Holland, who is an amazing practitioner on fertilitymindset.com. You can go on her website and have a look at the services she's offering. She's a dedicated professional with amazing digital and also physical presence, and we have proudly treated together dozens of patients all over the world with amazing success. Here, I will introduce you Jackie and Ray with a fertility support group based in Coventry, offering on-site and online services, dedicated, amazing people. They're also my personal therapists. So I'm very thankful. We have done some amazing work together, and it's always very refreshing and rewarding for me to work with them. So you can go on their website and you can sense the level of support you can get from those people. Now, ScanAssure and the team of Roy Craven, one of the most passionate doctors I've ever met, consultant radiologist on the NHS, based in Greater Manchester, but soon now expanding onto London, offering amazing services, 7 days a week, affordable scans at top level, amazing team of dedicated experts, wonderful communication. So, go on them. Lots of our patients, they follow up even after the pregnancy, they go and have pregnancy scans, and thank you, ScanAssure team, for offering those reassurance scans, all sorts of scans. So they're there, and they also offer blood tests as well. The amazing Mary McCaffrey is based in Ireland. She's offering all sorts of private gynecology services, covering all the spectrum, all the women of all ages, maternity, fertility, gynecology, shared care, IVF. And we have been working for many years together, very successfully, have been through some very difficult and challenging cases with very good outcomes. And also Mary is a very passionate advocate of the rights to fertility options and fertility care for women. And hopefully very soon she will have some amazing news to share, not only in the fields of egg donation and sperm donation, but also in surrogacy services. So hang in there, Mary, and looking forward to working with you more closely. Now, this is Professor Amso. He was my tutor and mentor during my training times in England, and I'm very thankful to him for putting up with me for so many years as a trainee. And now he's based in Wales, in Cardiff. He has this amazing clinic offering wonderful services, in particular scanning, fertility specialist services, minimal access surgery, and all sorts of wonderful services that can support you in your journey and also even in your early pregnancy. And Nazar Amso is the co-author of one of the largest textbooks on endometriosis in the world, only came out a few months ago. And I feel very honored and privileged that he gave me the opportunity to publish this book in Greek for the Greek and Cypriot countries and the Greeks all over the world for this exciting disease that's unfortunately affecting a lot of fertility patients. Andrea Trigo, she's a pioneer, she's an entrepreneur, she's a nurse, she's a sedation specialist, she's an inspiration for many of us, including myself. She has this program, Enhanced Fertility. She's a receiver of multiple awards. She had this amazing idea of providing home fertility test kits, awarded, supported by Innovation UK, presented in multiple conferences, her amazing results. So all in all, visit her website and see how you can benefit from her services. She has developed this amazing algorithm with artificial intelligence aiming at diagnosing your fertility and also directing you automatically and sometimes with a little help of specialists into the testing that is necessary in order to start your journey, and all of that in the comfort of your own home. So keep it up, Andrea. Looking forward to expanding your program in Europe and in Greece. For that reason, I'm sure a lot of patients all over the world will benefit from you. Last one, but not least, Dave Gibbon. Dave is my best friend. We've been together, as friends, as colleagues for more than maybe 40 years now, worked together in the north of England. David Gibbon is one of the pioneers, one of the first embryologists in England, an amazing person, amazing scientist. He's a retired embryologist, and he's available anytime to each one of you. You can have a cup of tea with Dave in the north of England and discuss your options, your concerns. You can call him up. He's there. Not only is he supporting patients, but he's also supporting doctors and teams, including myself. And we're very grateful to have such a person, such a scientist on our side. So these are the sources I can share with you at the moment. I hope there's going to be more in the future. Thank you so much for listening. And please fire away questions. Thank you. Right. Okay. Right. There are a few questions here, so I will try and answer them one by one. As a Black woman, can I be entitled to get a Black woman egg donation? Absolutely, absolutely is the answer. Okay, the only challenge here is the fact that dark egg donors are not that many. So the only issue here is the availability in terms of medical aspects, in terms of legislation, in terms of availability, and in terms of success. Everything is standard. I mean, dark egg donors, Asian egg donors, in general, they're pretty rare in Europe. However, now with the ability of transporting eggs from all over the world, this is being sorted out. So please, don't be hesitant. Just move on to the journey, and I'm sure you will find the right solution. Depending on your location, what I would suggest initially is talk to your nearest clinic. If you want to send us an email, we can always refer you to the nearest clinic in order to get a possible solution. And of course, if you want to come to us again, we would guide you accordingly. I mean, there's one thing I would like to clear here. I like to think of Embryoclinic and my team as a network, as an umbrella, aiming at supporting you wherever you are. Our aim is not to get you over here or to direct you somewhere. Our aim is to give you the best possible option, to share with you the best possible available resources, to empower you, to make you understand your diagnosis, your challenges, your difficulties, so that you can then make the informed choice. And of course, one of our top choices is always the NHS. I mean, if you're available for NHS IVF, we would strongly suggest you start from there. I mean, as you understand, fertility treatment, IVF is a package of treatments, and part of our job and part of our mission as healthcare professionals is to give you the best possible option for your situation and not to get you into our facilities. I think we all share this feeling. And to be honest, I think this is what makes us even more useful, if you like, to empower you in your decision making. So, greetings from Germany. Thank you so much, Dimitris and Cosima. Thank you. I'm very touched and honored. I'm looking forward to visiting you, and I'm looking forward to putting Germany on the map of our amazing partners and collaborators all over the world. And I'm sure that we can all benefit from your amazing services. To be honest, I can't believe how lucky I am to have met you. And I'm looking forward to working closely with you and offering our patients all over the world with your amazing services. Thank you. Okay, the US. Okay, there's another question regarding costs. I'm not very good in discussing costs. I mean, all I have to say is that there's different costs in every country. That doesn't reflect on the quality at all. What it means is that the standards of living are different. So if the standard of living, the salaries, the per capita income, this is what determines the costs of IVF. So there's no cheaper or more expensive IVF. It's the IVF services, like all services, like real estate, like hotels, like restaurants, in every country, of course, they vary. I think it's our duty to share that with you. The standards of licensed clinics, at least all over Europe, more or less they fulfill minimum standards. It's just a matter of what suits you best. So I think it's part of our duty to share with you perhaps the characteristics of our clinics. Each clinic has various characteristics, and of course, if those characteristics they fit with you, then go ahead. If you feel that you don't feel comfortable with this, then look for another option. But at some stage, you have to press the start button. Don't do it too quickly, but also don't delay it too much either. Okay. Other question. Waiting list for IVF. I mean, the waiting list depends on the clinic, depends on the times. I mean, I will talk about Embryoclinic. At the moment, the egg donation waiting list is about 3 months, which means that from the moment we perform the pre-IVF testing and we have sperm available, we can talk about embryo transfer within 3 months. Now, the protocols we use, they can either be solely performed in our clinic, but usually we promote that you have your preparation locally, and we provide you with some options of associates in your region. Of course, you can always find your own clinic or your own facility where you would do your scans and blood tests, and then our team of coordination would ensure that everything is done in a normal fashion in order for you to come for your embryo transfer. Okay, telephone consultations. Yes, how do I start is the other question. How do I start? If you're interested, first of all, you send an email to info@embryoclinic.eu. The team of coordinators will pick up this email, and depending on your location, depending on your characteristics, they will direct you to a dedicated coordinator for your case. The second step would be for you to fill in a fertility questionnaire. It's very simple. It's only 2 sides. It takes less than 5 minutes to fill in order to get an idea of your needs and to understand your medical and issue. And following this, if we feel that we can undertake your care, we offer you a free consultation with a specialist. I always try to be the one who does the consultation. I'm not always 100% successful, but my team of amazing fertility specialists also are more than capable of performing that consultation. This is free for 15 to 20 minutes, and during this time we understand better your situation, and of course we are available to discuss the options and give you perhaps the next possible step. If it's a matter of pre-IVF testing, then we give you the option to perform the pre-IVF tests locally, if this is possible. And if this is not possible, we give you the option of performing the IVF testing with us. Now, with regards to fertility surgery, again, depending on your situation, depending on your location, we would give you the option to have the fertility surgery performed either locally or with us. So if locally, for example, you're eligible for NHS, if you're in England, or you're eligible for state services, if you're in Germany or in another European country like in Serbia, then that's fine. We promote that. If you're not suitable for NHS and you're going to go private, then again, we give you the option of having private surgery there or here. So all in all, we work together with you. I mean, I know that some clinics are a little bit strict. They don't accept treatments or blood tests or whatever from other hospitals. We are a little bit more democratic, if you like. We accept anything that's performed anywhere. Of course, then we evaluate clinically. And our aim is to get all the boxes ticked. It doesn't matter if the tick is by our hand or by some other specialist's hands. We like to be concise and quick. We promote some particular times in the year. For example, traveling to Greece in August perhaps is not the best idea, but sometimes Christmas is not a good idea. So we also give you some logistics for your travel, depending on your situations. We have some amazing couples and patients from Canada, for example. We had a couple, they dedicated 2 to 3 months here. They worked remotely. We did everything here and so forth. So we have the possibility to work with you towards the best individualized scheme that would be available. And of course, my team and I, we have a lot of ways to support you in your travels and your accommodation and all that. There's a dedicated team for that. Another question. We live in England. We have a little one coming to 4 years old, been trying for a long time, but now I'm 44, getting a bit pessimistic. We're thinking of looking at the option of IVF more seriously. How easy would this be? Does it help that we already have a toddler? How can we start the process? Okay, thank you, Anonymous. I mean, basically, yes, absolutely. I mean, you're 44. Firstly, we do the pre-IVF testing. Okay. If you want to send us a fertility questionnaire, depending on your situation, my coordinators can send you some recommendations regarding the tests that you would probably need to do. If you want to go on under a Tsakos platform, enhanced fertility, just put in your characteristics and you should be able to get your automatic response, no strings attached. If you want a consultation, by all means, I would be more than happy to give it to you. The chance, I mean, at 44, it's the own egg IVF chances that are reduced. You know, the overall chances of having a second child are extremely high. And of course, it helps that you have a 4-year-old. Of course, it helps to remind you how wonderful it is. What we have found over the years is that secondary infertility can be more challenging, more stressful than primary infertility, my dear Anonymous. Why? Because you know what it means to have a baby. You know how precious, how wonderful it is. And of course, it's only natural to want to complete your family with a second or a third. So don't give up. Don't be pessimistic at 44. You have all the resources. Press the start button, and we would be delighted to help you. Okay, I have time for 2 more questions, and then I will let you enjoy your Sunday lunch. When am I next to England? Okay, I'm in London the beginning of June. So by all means, just drop us a line. We usually hold informal conferences, informal meetings in hotels, maybe in the Royal College. Sometimes we meet in Green Park, just walking by the benches there. You know, we try to be as informal as possible. So London, in the beginning of March. I should be in Manchester in the beginning of June, sorry. I should be in Manchester sometime before the summer, not exactly sure when. However, don't wait for this. If you want to get online, just send us an email and we should be able to answer and give you specific care. Now, if you want any of our team in London to look after you, in particular the Alpha Zeta team, Gordana Petrovic, she's between London and Serbia at the moment. So drop us a line and we'll get you in touch with her. She's very experienced overall infertility coaching and all that. She's by trade, she's an acupuncturist. She is my personal acupuncturist as well. And I can reassure you that she's amazing. So get in touch with her. Claire Spink, Alpha Zeta member. She's a fertility massage. She's the inventor. She's the person in the world, the person who invented the value of fertility massage. She's in Mersey Island at the moment, but I'm pretty sure that she can help you and she does online. So get in touch with her either directly or through Alpha Zeta. Dave Gibbon, he's always available for our patients. He doesn't charge a penny. He likes to help people. That's his mission and vision in life. We're very fortunate to have him. We call him Mr. Dave, Dr. Dave, but he's our Dave. So, you know, we can always get you in touch with him for any advice and help. Rosie Letts from Alpha Zeta, she is a fertility nutritionist. She does a lot of online coaching, counseling. She has an amazing platform. So if you want to get your diet, your weight, your nutrition, well-being sorted, she is the person to talk to. And of course, Sarah Holland, who has amazing services, again, online, offline, in person. Get in touch with her. And similarly, with all the other recommended resources that I mentioned. So thank you very much. I'm sorry I don't have much more time. And, you know, my kids are just now tooting downstairs, so I have to go. Wonderful talking to you all. Keep in touch, keep connecting, keep trying. Anything we can do, don't hesitate. You know, we're not your normal fertility clinic. We like to think that we can offer you services complimentary as much as we can. We would like to direct you. There's amazing NHS resources all over England, and I would be more than delighted to share my knowledge, my contacts, and provide you with the best possible empowerment in your journey. And thank you so much for listening in, and hope to see you soon. Thank you.